Welcome to this clinical walkthrough on an asymptomatic gonorrhea case for UKMLA brought to you by Mediate, your 24/7 practice partner. Today, we're going to break down a really common but pretty tricky scenario. I'm here to walk you through every single step.
So, here's our game plan. We've structured this around the 5 critical stages of the consultation. This is your roadmap to absolutely pass this station. Let's get to it.
Okay, let's dive right in with opening the consultation. Honestly, your first few sentences are crucial. They set the tone for everything that follows, so let's make sure you nail it.
So, what are you trying to do here? It's actually pretty simple. You've got 2 goals. First, just confirm why they're in front of you. And second, offer them a choice in how the conversation goes.
Here's the exact phrase you can use. This is just perfect because it instantly shows you're a great communicator. You're putting the patient in control right from the start, which is a huge mark of respect.
Right. You've built that initial rapport. Now it's time to gather all the information you need. This is where you really start building your case. Let's see how it's done. Now, I know the case says asymptomatic, but you absolutely must run through a full symptom review. You have to ask these screening questions to officially confirm it. It shows you're thorough.
Next, you need a quick run-through of the patient's medical and gynecological background. Pay really close attention to their contraception use. That's a key piece of the puzzle. Okay, before you jump into their sexual history, you have to pause and ask for permission. Always use this phrase. It's a simple way to get consent and show you respect their privacy.
So, the whole point of these questions is to find the risk factor. And in a case like this, the risk factor is usually inconsistent condom use. That's what you're looking for.
Just a quick pause here to remind you you can practice this exact case right now and get objective feedback on mymediate.com.
And now we're at a critical moment. This is where you have to deliver the bad news. Your ability to do this with empathy is being tested here. This script is fantastic. Why? Because it's direct, it's informative, and it ends with reassurance. You're actually thanking the patient for being proactive about their health. It's a brilliant touch. After you've given the diagnosis, you need to present a clear, structured management plan. You have to show them the path forward.
Your management plan should always cover these 5 key areas, and you should do it in this logical order. It makes everything so much clearer for the patient.
When you explain the treatment, keep it simple. The patient needs to know exactly what to expect. No confusing jargon, just the straightforward facts.
You have to give direct, unambiguous advice on how to prevent this from happening again. Be clear, but make sure your tone is supportive, not judgmental.
Partner notification can feel really awkward for the patient, so you need to explain the process clearly and emphasize that it can be done anonymously. That confidentiality piece is so important.
And this is how you provide a complete safety net. You're telling them exactly when to come back for help and what the plan is for follow-up. This is about ensuring they're okay in the long run.
Finally, you need to be ready for their questions. They're going to have concerns and fears, and your job is to address them with clarity and reassurance.
What's so great about this slide is how it prepares you for the 3 most common questions with these clear, non-judgmental answers. When you mention the complications, like pelvic inflammatory disease or PID, you must explain that it's an infection of the womb, tubes, and ovaries. If you master these responses, you'll sound confident and empathetic.
You can practice this exact case now on mymedia.com.